When any surgical procedure is being considered, it is always important to discuss the potential risks and complications associated with the surgery. Nobody likes to think about the possibility of complications with their surgery, but it's important that the patient understand all the potential risks so that they can make an informed decision about their care. Wisdom tooth surgery is a very routine procedure, and the incidence of any significant complications is exceedingly low. As with any procedure, no matter how routine, there are still certain potential complications that need to be reviewed. The main risk is related to the large nerve that travels through the bone of the lower jaw and supplies the sensation to not only the jaws and the teeth, but also the lower lip and the chin. This is the nerve that the dentist anesthetizes for routine dental procedures. In many cases, the roots of the impacted wisdom teeth can come very close to or actually touch this nerve, and there is always the concern that this nerve could be pinched or bruised in the process of removing the tooth. If this nerve is pinched or bruised or damaged during the course of surgery, the nerve will usually shut down and stop working, which would result in a persistent numbness of the lower lip and the chin. This nerve controls sensation only and does not affect the muscles of the face. This numbness could be simply a mild tingling sensation, or it could be complete numbness, just like one would experience following a local anesthetic injection. This complication is very rare, occurring in only a fraction of 1% of all lower wisdom tooth extractions. Of this very small number of cases, the majority will return a normal sensation within several weeks or several months following the surgery. The risk of permanent nerve injury is extremely low, but is of course possible in any case where the impacted tooth is close to the nerve. We take great effort to avoid any excessive forces during removal of these teeth to minimize the risk, but despite the best efforts to remove these teeth as judiciously as possible, the risk of nerve damage is still always a concern.
There is also another nerve that is a potential concern, and this is the lingual nerve, which supplies the sensation to the side and the tip of the tongue.
In some patients, this nerve may come close to the surgical site and consequently may be stretched or injured during removal of the tooth. This may result in a similar alteration of the sensation of the side and the tip of the tongue, but fortunately this is extremely rare as well, and in those instances where it does occur, it usually returns to normal over time. With the upper wisdom teeth, there are no large nerves to be concerned about, but the sinuses are very close and often directly contact the roots of the impacted teeth. On rare occasions, there may be a small hole left into the sinus following removal of the tooth. If this were to occur, it is usually not a problem, as a blood clot normally forms in the socket left by the tooth, and this clot acts much like a cork in a bottle to seal up the hole. The clot is then replaced by bone over time. During the first 2 weeks following surgery, it is best to avoid any activities which would create pressure in the sinuses. If air pressure were to build up in the sinuses, it may force air down through the hole left by the tooth and dislodge the blood clot and allow the formation of an air tunnel between the sinus and the mouth through the tooth socket. We ask all of our patients who are having upper wisdom teeth removed to follow certain precautions to minimize the chances of sinus problems after surgery. These precautions consist mainly of avoiding things that may cause sinus pressure, such as forceful nose blowing or sneezing through the nose, for about 2 weeks following surgery. It is okay to sneeze, just remember to try and expel the air through the mouth instead of the nose to take the pressure off the sinuses. Other potential complications include the usual concerns after any surgery, such as infection or excessive bleeding, both of which are uncommon. Although due to the low incidence of infection after this type of surgery, the routine use of antibiotics is normally not required, your surgeon will determine if antibiotic coverage is appropriate in your case. Existing TMJ or jaw joint problems can be worsened following surgery, although this is usually temporary. Significant anesthetic complications in this type of surgery are exceedingly rare. The extensive anesthesia training that all oral surgeons have had, modern sedation techniques and medications, and advanced monitoring equipment make office sedation and anesthesia extremely safe. Anesthetic problems or complications can, of course, occur, but these are usually minor in nature and normally can be easily recognized and corrected by your surgeon. All oral surgeons have had extensive training in the management of anesthetic and medical emergencies and are trained and equipped to deal with any emergency situation that may arise.
The most common postoperative problem that is normally encountered is called dry socket. Dry sockets usually occur in the extraction sites in the lower jaw and may be seen as frequently as 1 out of every 4 or 5 patients, so it is a very common problem following the removal of wisdom teeth. Dry sockets occur when the blood clots that form in the sockets following removal of the tooth dissolve away, leaving empty sockets with bare bone exposed to the mouth. When this happens, the gum tissue usually opens up, and this creates a large hole that tends to collect food particles. A dry socket is not a serious problem, but may be quite painful. Dry sockets don't usually show up until after the first 48 hours following the surgery, and sometimes may not even occur until 5 to 7 days after the procedure. Fortunately, this problem is easy to treat. Once we recognize that a dry socket is present, we wash the socket out with a little sterile water and gently place a small packing. The packing fills the socket and keeps food particles from falling into the empty space, and the medication on the pack numbs up the nerve endings in the bone and takes the pain away, usually within 10 to 15 minutes after placing the pack. Fresh packings may need to be placed every few days, but the number of times that this may be necessary varies from patient to patient.